Your legs feel heavy by the end of the day. Your ankles swell. You wake up puffy around the eyes and face. You feel bloated even when you have not eaten much. You are tired in a way that sleep does not fix. And when you mention any of this to your doctor, you get the same answer. Drink more water. Cut back on salt. It is just your circulation. It is just your age. What if none of that is the real explanation? What if there is an entire system in your body? One that most doctors never discuss, never test, and almost never treat? That is responsible for every single one of those symptoms. And what if that system can be restarted with nothing 15 minutes a day, no equipment, no medication, and no gym membership? I am Dr. Michael Lai, and today I am going to show you exactly how to do that. I'm going to explain what your lymphatic system actually does, why it slows down after 60, and the 3 things you can start doing today to get it moving again. And at the end of this video, I am going to tell you the one thing that millions of people do when they discover lymphatic drainage that actually makes the problem worse instead of better. Stay until the end, because this is the mistake that wastes months of effort. Before we begin, leave me a comment right now telling me where you are watching from. I have people joining from the United States, Australia, the United Kingdom, Canada, and beyond. And tell me this, do you have swollen ankles or legs that feel heavy by afternoon? Right? Certainly never sat down and explained to you. Most people know they have a circulatory system. Your heart pumps blood through arteries and veins. That system has a pump, your heart, and it works continuously whether you are moving or not. What most people do not know is that you have a second circulatory system running parallel to the first one. It is called the lymphatic system, and it is actually larger than your blood circulatory system. Your body contains roughly twice as much lymphatic fluid as it does blood. The lymphatic system is a network of vessels, nodes, and organs that runs through virtually every tissue in your body. It has 3 jobs that nothing else in your body can do. First, it collects the excess fluid that leaks out of your capillaries into the surrounding tissue and returns it to your bloodstream. Without this, your tissues would flood. Second, it transports the fat and fat-soluble vitamins you absorb from food in your digestive system. Third, and most importantly, it is the highway of your immune system. Your white blood cells travel through lymphatic vessels. Pathogens, cellular waste, dead cells, toxins, and metabolic byproducts are collected in lymph fluid and carried to lymph nodes where they are filtered and neutralized. Here is the critical difference between your lymphatic system and your circulatory system. Your heart pumps your blood. Your lymphatic system has no pump. It relies entirely on 3 things to keep fluid moving: muscle contractions when you move your body, the movement of your diaphragm when you breathe, and the gentle pressure of your body against surfaces. When those 3 things are present and working well, your lymphatic system hums. When they slow down, and after 60 they almost always do, lymph fluid begins to pool, tissues swell, waste accumulates, immune function drops, and you start experiencing exactly the symptoms I described. Now, let me tell you the 3 reasons this system slows down after 60, because understanding this is what makes everything I am going to share today make complete sense. The first reason is reduced physical activity. This is not about fitness level. This is about the simple fact that most people over 60 move less continuously throughout the day than they did at 40. Sitting for extended periods, at a desk, in a car, watching television stops the muscle contractions that push lymph fluid through the vessels. The lymphatic system in your legs is particularly vulnerable to this because those vessels are fighting gravity to return fluid upward. When you sit for hours, fluid pools in the lower limbs. This is why your ankles swell and your legs feel heavy by afternoon. It is not a circulation problem in the blood sense. It is a lymphatic drainage problem. The second reason is diaphragmatic breathing changes. Most people breathe shallower as they age. Stress, poor posture, desk jobs, and years of tension in the chest and abdomen all contribute to breathing that stays in the upper chest rather than the full belly. The diaphragm is the most powerful driver of lymphatic flow in the trunk of your body. The thoracic duct, the main lymphatic drainage vessel in your body that collects fluid from your entire lower half, empties into your bloodstream in your chest, right next to where your diaphragm moves when you breathe deeply. Every deep belly breath creates a pressure differential that literally pumps lymph upward. Shallow chest breathing removes that pump almost entirely. The third reason is reduced hydration and dietary changes. Lymph fluid is approximately 95% water. Mildly dehydrated, and most older adults are chronically mildly dehydrated because the sensation of thirst becomes less reliable with age. Lymph becomes thicker and moves more slowly. Diets high in processed foods, refined sugars, and inflammatory oils also thicken lymph and burden the lymph nodes that are trying to filter it. Alcohol dehydrates and inflames the vessels. Excess sodium causes fluid retention that overwhelms the lymphatic collection system. Now let us talk about what you can actually do. I am going to give you 3 specific things, and I want you to think of them as a complete protocol rather than separate interventions. They work best together. The first thing is movement-based lymphatic drainage. You do not need a massage therapist. You do not need a special brush. You need to use your muscles in a specific way for 15 to 20 minutes a day. The most effective movement for lymphatic drainage in the lower body is walking. Not power walking, not hiking. Simple flat surface, walking at a comfortable pace. Every step you take contracts the calf muscles around the lymphatic vessels in your legs, creating a pump action that pushes fluid upward. 20 minutes of walking moves more lymph fluid from your lower body than an hour of sitting with your legs elevated. If walking is difficult, the second most effective movement is ankle circles and calf raises done seated. Sit upright in a chair. Lift both heels off the floor and hold for 2 seconds, then lower. Do 20 repetitions. Then rotate both feet in slow circles, 10 clockwise and 10 counterclockwise. This directly activates the lymphatic pump in the calves without requiring any weight bearing. Do this every hour if you spend significant time sitting. The frequency matters more than the duration. 5 minutes every hour is more effective for lymphatic flow than 30 minutes once a day. For the upper body and face, for the puffiness around the eyes and jaw that many people notice in the morning, the most effective movement is gentle neck rotation combined with shoulder rolls. Sit upright. Slowly drop your chin to your chest. Then roll your head gently to the right ear toward the right shoulder, back to center, and to the left. Do this 5 times each direction. Then roll both shoulders backward 10 times in slow full circles. The lymph nodes that drain your face, scalp, and neck are clustered in your neck and just below your collarbones. These gentle movements activate the vessels that feed those nodes. One more specific exercise that most people are never shown. Lie on your back on a flat surface. Raise both legs straight up against the wall or the back of a couch so that your legs are vertical and your hips are close to the wall. Stay in this position for 5 to 10 minutes. Gravity alone does more to drain lymph fluid from your legs in 10 minutes of this position than 2 hours of sitting with feet elevated at a 45-degree angle. The vertical position is key. This is one of the most powerful passive lymphatic drainage techniques that exists, and it requires no effort, no equipment, and no skill. I want to pause here and ask you something in the comments. Before today, had you ever heard of your lymphatic system? Not just the word, but what it actually does and why it matters. Write yes if you knew, no if this is new to you. The answer to this question tells me a lot about what to cover next, so please take 5 seconds to respond. The second thing is diaphragmatic breathing. This is not a wellness trend. This is a mechanical fact about how your body moves fluid. I'm going to give you a specific protocol that takes 5 minutes and can be done sitting in a chair, lying in bed, or standing in your kitchen. Place one hand on your chest and one hand on your belly, just below your ribs. Take a slow breath in through your nose and try to push the hand on your belly outward while the hand on your chest stays as still as possible. You are filling the bottom of your lungs first, which forces your diaphragm down, which creates the pressure differential that drives lymphatic flow in your trunk. Hold for a count of 2 at the top. Then exhale slowly through slightly pursed lips for a count of 6, longer than the inhale. The slow exhale creates a sustained negative pressure in your chest that continues to pull lymph fluid upward even as you breathe out. Do 10 of these breaths 3 times a day. Morning, midday, and before sleep. The morning session is particularly important because lymph fluid has been pooling overnight in many tissues, and your first deep breathing session is what starts moving it. This is why people who practice diaphragmatic breathing consistently report significantly reduced facial puffiness in the morning within 2 to 3 weeks of starting. The clinical evidence behind this is not fringe. A 2017 study in the journal Lymphatic Research and Biology documented that deep diaphragmatic breathing significantly increased lymphatic flow velocity in the thoracic duct. The researchers described the diaphragm as a secondary lymphatic heart, a term I think makes the mechanism immediately clear. The third thing is dietary and hydration support for your lymphatic system. This is less about adding specific superfoods and more about removing the things that actively burden the lymphatic system and adding back the basics that it requires to function. Water first. Your lymphatic system needs you to be properly hydrated to function. The standard recommendation of 8 glasses a day is a starting point, but a more accurate guide is the color of your urine. Pale yellow throughout the day means you are adequately hydrated. Dark yellow or amber means your lymph is almost certainly thickened. Start your morning with 16 ounces of water before anything else, before coffee, before breakfast. Your body has been doing low-level lymphatic drainage all night, and replacing that fluid first thing gives the system what it needs to continue. Anti-inflammatory foods directly support lymphatic function by reducing the burden on lymph nodes. The lymph nodes are your filtration system. When you eat a diet high in inflammatory foods, refined oils, processed sugars, refined grains, alcohol, you create more inflammatory byproducts that your lymph nodes have to filter. Over time, chronically overburdened lymph nodes become sluggish. The foods that have the most direct evidence for supporting lymphatic health are leafy greens, particularly those with chlorophyll. Spinach, kale, parsley, cilantro. Beets, which support liver function, and therefore reduce the burden on lymph nodes that drain to the liver. And citrus, particularly lemon, which appears to support the contractility of lymphatic vessel walls. 2 things to reduce specifically for lymphatic health. Sodium, not because salt is universally bad, but because excess sodium causes fluid retention that overwhelms the lymphatic collection system. If your ankles swell and you eat a high sodium diet, reducing sodium even modestly will show a noticeable reduction in swelling within a week. And alcohol, even moderate alcohol consumption, dehydrates and inflames lymphatic vessel walls. If swelling is a significant problem for you, removing alcohol entirely for 30 days and observing the change is a worthwhile experiment. Now, I told you at the beginning there is one thing that people do when they discover lymphatic drainage that actually makes the problem worse. And here, with too much pressure, too frequent, is what you need to understand about dry brushing. The lymphatic vessels that you are trying to stimulate are not deep in the wrong direction on inflamed or already swollen tissue. And then they wonder why the swelling gets worse. Here's what you need to understand about dry brushing. The lymphatic vessels that you are trying to stimulate are not deep in the muscle. They are just under the surface of the skin, in the superficial fascia. The pressure required to stimulate them is almost embarrassingly light. If you are pressing hard enough to leave red marks or feel the bristles deeply, you are pressing so hard that you are compressing the vessels shut rather than opening them. You are doing the opposite of what you intend. The correct technique for dry brushing is this. Use a natural bristle brush with long enough bristles to be soft at the tips. Apply pressure